Hello everybody. Today we are going to talk about diabetes in Aboriginal and Torres Strait Islander. Before we begin, we want to acknowledge that we are on a traditional paramagrical land and it always be so. Also, we pay our respect to elders, past and present. First of all, I would like to introduce my group members, myself, Bires, Baisali, Riyadh, Barsha, and Ashin. Today in this video, Bires, have given my voice in which our group will elaborate and cover the issues of diabetes mellitus amongst the Aboriginal and Torres Strait Islanders people. Before giving you any information, let us familiarize you with the topic included in the presentation video. Foremost, we are going to discuss how culture plays a role in Aboriginal Torres Strait Islanders' health. Next, we also talk about diabetes and its consequences among Aboriginal and Torres Strait Islander, followed by associated social determinant of health. Furthermore, we will examine the importance of health promotion as a healthcare need. Lastly, we will address culturally competent and safe nursing practice in relation to diabetes in remote areas. It is a well-known fact that the traditional owner of Australia are Aboriginal and Torres Strait Islanders. They have coexisted with this land for over 60,000 years. During this time, they were healthier as opposed to today. The traditional food culture at that time was to hunt and gather. The unfair law and the communicable disease brought by the First Fleet resulted in Aboriginal and Torres Strait Islanders being driven away from the traditional land. The introduction to easily contracted disease such as smallpox and ill practices of alcohol and drugs resulted in lower health status amongst Aboriginal and Torres Strait Islanders community. As a result, their spiritual connection with their land were broken, which led them to live an inactive life. The inactive lifestyle caused them to develop a chronic disease such as diabetes, heart disease, and many more. What is diabetes mellitus? Let us explain to you what is diabetes mellitus and how much it affects Aboriginal and Torres Strait Islanders' health. Diabetes is an epidemic of 21st century and it is one of the biggest challenges confronting Australia's healthcare system. Approximately 1.7 million Australians have diabetes, with 280 Australians being diagnosed with it every day. To put things into perspectives, in every 5 minutes, someone is being diagnosed with the diabetes. Diabetes is a chronic disorder in which a person has a high blood sugar level, either because the body did not produce enough insulin or because cells do not respond adequately to insulin produced. There are two main types of diabetes, namely type 1 diabetes and type 2 diabetes. Type 1 diabetes is characterized by the autoimmune destruction of insulin producing cell in pancreas, means when pancreas doesn't produce insulin. What is type 2 diabetes? Type 2 diabetes is the most common form and is characterized by reduced production of insulin and inability of a body tissue to respond fully to insulin. Especially Aboriginal and Torres Strait Islanders are 3 times more likely to have type 2 diabetes compared to non-Indigenous Australian. There are many associated factors develop diabetes, such as obesity, family history, less physical activities, stress, and habit of alcohol and smoking. According to Australian Indigenous Health Welfare 2007, diabetes is linked with the socioeconomic status. For example, the greater the environment, social and economic disadvantage experienced by Aboriginal and Torres Islander people, the higher the level of type 2 diabetes. As a result, it will increase the risk of associated problem with other chronic conditions in the population. If the chronic condition is left untreated with, it will increase the risk of other serious conditions like heart disease, diabetic foot, stroke, renal failure developing in the future. To justify the seriousness of diabetes amongst Aboriginal and Torres Strait Islanders, let's show you the statistics. This graph is from survey conducted by Australian Bureau of Statistics in 2013, where it was found 10% of Aboriginal and Torres Strait Islanders in remote areas are living with the diabetes. It is essential to remember, due to lack of awareness about the diabetes mellitus, there could be even more Aboriginal Australians affected by it. According to Australian Institute of Health and Welfare 2014, Aboriginal and Torres Strait Islanders, male and female, were more likely to be hospitalized for each type of diabetes than non-indigenous counterpart. According to above table, disparity was greatest for Aboriginal and Torres Strait Islanders female, with the principal diagnosis of type 2 diabetes, which were 8.1 times more likely to be hospitalized than non-indigenous females. It is well-known fact that economic and social conditions such as money, power, resources determines one's health. Social determinants of health are causes of the causes which are responsible for the health inequalities. There are three social determinants of health related to Aboriginal and Torres Strait Islander in context to diabetes, which we will be focusing on. These are education and literacy, health practices and coping skills, and access to healthcare services. The few following slides will show you up to which extent the social determinant of health impact Aboriginal and Torres Strait Islanders. Education is one of the important social determinant of health affecting the health amongst Aboriginal community. In 2015, Australian Curriculum Assessment and Reporting Authority found that there was a gap of 24.1% between non-Indigenous and Aboriginal Torres Strait Islanders students attending school in very remote areas. This is large difference highlights the continuous need to encourage and empower the youth and their community to receive basic education where they are able to implement their knowledge in their daily lives. It is vital to educate youths and danger of unhealthy food, alcohol, and drugs, as well as the long-term impact it has an individual's body. Secondly, we would like to focus on a health practice and coping skills among Aboriginal and Torres Strait Islanders by providing information about nutrition and correct food group that should be consumed. This is a need to train the youth and their communities to make right decisions and breaking the cycle. An initiative started by Nimupua Cave Yoke Health Council called Good Food for Good Sugar 2016 illustrates a healthy diet suitable for an individual suffering with the diabetes. The focus here is on eating regularly and not skip meal, spreading out sugar throughout the day, eating more whole grain and high fiber food, and choosing products with the reduced fat instead of deep fried food. Furthermore, the poster also lays out healthy alternative in every meal throughout the day. This ensures the person struggling with the diabetes is not stuck with the mundane meal every day. By providing these healthy alternatives, a diabetic patient will be more willing to follow their diet and not return to unhealthy fatty food. This initiative is an excellent example for easy to follow meal guidelines, which act as a coping tool for new diabetic patients. Now we will discuss about third and last chosen social determinant of health, that is access to health care services. According to the survey conducted by National Aboriginal and Torres Strait Islanders Health Survey in 2005, it was found that 1 in 7 Aboriginal Australians in a remote area needed to see a doctor in past 12 months, but didn't go. Aboriginal and Torres Strait Islanders female were more likely than Aboriginal men to report that they had needed to go to doctor or dentist but hadn't gone. Factors such as distance, cost, long waiting time, and transport were reported as main resources which deterred them from going to see a doctor. Therefore, there are numerous Aboriginal and Torres Strait Islanders are living with the diabetes but not aware of it, as they are hesitant to travel to their nearest healthcare center. Aboriginal and Torres Strait Islanders have been reluctant to seek healthcare services due to Western dominant model of care used by healthcare professions. Additionally, a lack of understanding towards their culture also been one of the reasons that have influenced Aboriginal and Torres Strait Islanders from going to any healthcare services. In order to tackle this issue, it is essential to create culture awareness in all remote health services centers. Hence, it makes evident the importance of health promotion as well to improve healthy health, which we'll discuss in the next slide. As we have seen previous slides emphasize the role of health promotion in Aboriginal health. What is meant by health promotion and how can it be done? The World Health Organization, WHO, describes health promotion as the process of enabling people to increase control over determinants of health and thereby improving their health. Health promotion works on a three guidelines principle. These are advocate, enable, mediate. Health promotion by and with the Aboriginal and Torres Islanders plays a significant role in closing the wide gap in a health status that this community has as compared to other Australians. The higher distress of diabetes in Aboriginal and Torres Strait Islanders people can be minimized with the help of health promotion strategies. These strategies must consider as there are much higher scope to prevent illness among young population. The operation of Aboriginal Community Controlled Health Services, SCCHS, established in Redfern, was first initiative in relation to Aboriginal and Torres Strait Islanders health promotion strategies. Now let us introduce you to some of the projects established by the government and the organization to upgrade the health outcome around diabetes in Aboriginal communities. It includes Guri Diabetes Complications and Assessment Clinic, which was directed in 2004. During the clinic session, local Aboriginal and Torres Strait Islanders community members were provided with the multidisciplinary team within one clinic settings. Secondly, looking at the Better Living Diabetes project, which was implemented by Gundir Aboriginal Torres Strait Islanders Corporation for Health Services in 2001, received positive response from the community. The reason it was beneficial because it was arranged with the community consultation. While looking forward, the Laramba Diabetes Project, Urli Jang Diabetic Day Program are the few other health promotion programs implemented for the Aboriginal and Torres Strait Islanders people. Although both the government and non-government organizations produced and reproduced various health promotion tools, but most of them implemented without carefully assessing its effectiveness. In addition to this, the main drawback to delivery community-based diabetic education is related to lack of Aboriginal resources as well. To upgrade the Aboriginal Torres Strait Islanders' health, there are few techniques that can be used as a health promotion tools. The health promotion strategies which we are going to focus includes two components. Firstly, to increase awareness among community, and secondly, to strengthen the health resources with culturally competency. As discussed earlier in the presentation, diabetes is 3 times more likely to occur in Aboriginal and Torres Strait Islanders people. It is associated with array of complications. If diabetic remains untreated, it can lead to complications like diabetes-related foot disease. The rate of diabetes related to lower limbs amputation due to foot disease is remarkably high in Aboriginal and Torres Strait Islanders, especially in the rural remote areas. The report has been done in 2016. Thus, it is important to create awareness in the community by conducting diabetes awareness program, which involves community members and elders. For example, services for Australian rural and remote allied health, SARA was developed. The NSW Aboriginal Diabetic Food Program to encourage people about food care. The use of local language media artwork and emphasis in this program. Additionally, through the program, it was significant that the language to be used for the food care message was created using local cultural knowledge and was discussed with the Aboriginal elders. Now moving towards the health resources available in relation to for Aboriginal health are not defining and efficient. There is a need to have a new resources. Here we will formulate some different ways in which resources can be strengthened with the respect to culture competency. The first step can be recruiting more local Aboriginal health workforce. Through the involvement of the community members in the healthcare workforce, culturally safe healthcare can be provided to Aboriginal Australians. It must be noted that Aboriginal health workforce can be effective in educating non-Indigenous staff by making them culturally competent. Thus, it results in providing culturally safe healthcare delivery. Furthermore, elders and Aboriginal health workforce should consider as a greatest resource while providing healthcare service. Alternatively, if an Aboriginal is not available in the community, we can still consult the highest respect person in the community to create equitable and appropriate program or services. Nurses and midwife profession plays significant role to improve the health of Aboriginal and Torres Strait Islanders people to reduce health inequity. According to Nursing and Midwifery Board of Australia (NMBA) and Professional Code of Conduct 2008, principal responsibility of nurses is to respect culture, ethnicity, belief of a patient. For example, nurses can show respect by avoiding direct eye contact without being judgmental and using gesture means to communicate with the Aboriginal patient. Nursing standard of practice must comply with the therapeutic relations and patient safety. Nurses should engage themselves in a continuous professional development to provide culture sensitivity care. This can be carried out by undertaking a specialist diabetes training, which incorporate Aboriginal and Torres Strait Islander learning, culture safety, and holistic approach to care Aboriginal people with the diabetes. Furthermore, awareness building regarding mental health and how it is affect diabetic patient to control the blood sugar plays significant role to enhance it. In addition to this, specific nursing care should be involved screening and early detection of type 2 diabetes, promoting self-care, regular blood glucose monitoring, periodic urine check, and oral therapies. It is clear that diabetes mellitus is significant health issues for Aboriginal Torres Strait Islanders, especially resulting in the remote areas. Lack of education and access of health services further worsen the prevalence and consequences of diabetes. There is a need to appoint Aboriginal community member in the Aboriginal health workforce and introduction of a diabetes program. It can be promoting Aboriginal health at culturally safe level. Also, nurses play critical role providing cultural competent healthcare. Nurses involve themselves in the therapeutic relations with the patient and provide relevant information about diabetes. In the end, a culture competent nurse is able to promote health and can encourage positive health outcome among Aboriginal and Torres Strait Islanders. So we are going to we have taken this material, all the materials from below references. And if you have any questions regarding our presentation, you can email us on my email, which is 18750762 at student.westernsydney.edu.au, or you can call us on the number 04015255063. And also, we'd also thank you for listening to us, and also we will be thanking to our lecturer, Mr. David, who is a mentor for us. Thanks a lot.